As far as Sindh's primary healthcare facilities are concerned, that's for our PPHI model, which has 93% rural coverage and 1,440 facilities managed across 30 districts. Our integrated emergency care services. This means your ambulance services. Before the Pakistan People's Party government in 2008, there was no integrated emergency service in Sindh. And now we have an integrated emergency service facility with the stats before you, how many patients and how many calls we receive on our hotline. The biggest sort of public interaction at any hospital is with your emergency services. That has the highest interaction for our public. And if you want to improve the public's experience with any hospital, you want to focus on improving their approach or their access to emergency services. We prioritized within that children's emergency services. And we've partnered with the Child Life Foundation across the province of Sindh in order to provide international standards, free of cost, emergency care to the children of Sindh. And we've established 10 emergency rooms across the province in partnership with the Child Life Foundation and 105 telemedical centers at secondary care hospitals. This is, again, as a result of our public-private partnership. Our mortality rate at the Child Life Foundation emergency care rooms that we're partnered with is at 1.2% and is at par with the best private hospitals in Pakistan. As a result of all these interventions, whether it's NICVD, whether it's SICH, whether it's a Child Life Foundation, there are many, like Indus Hospital sitting before us, that Dr. Bari, I haven't even mentioned in my as a result of these interventions, we're providing international standards, free of cost care to the people of our province, and we've seen quantitative results. Our infant mortality rate in Sindh has declined by 26%, from 74 in 2013 to 54.65 in 2024. Our media friends here will remember how much we were criticized on this topic, particularly in the context of Tharparkar. And I'm proud to share with you today that Sindh's infant mortality rate after these interventions by the Pakistan People's Party government today stands at 2.9%. That's lower than our national average of 5.4%. The second topic I'd like to discuss with you today is our education infrastructure. We face a whole host of challenges within the province of Sindh, education being amongst one of our priorities. Obviously, without access to education, our people have no hopes of prospering, economic progress, of getting jobs. And we're proud to say that we've prioritized not only our higher education, but also our primary facilities. In 1947, there was one university in the province of Sindh. 50 years, by 2008, there were 10 universities in the province of Sindh, and of those 10 universities, there were 2 additional campuses. And when you establish a campus, it increases the outreach of that university. Say there's a university in Karachi, and I can establish a campus in Badin or somewhere else. So it gives, still need one in Badin, but it gives access to rural areas. So by 2008, there were 10 universities in the province of Sindh and 2 campuses, mostly established in the 1970s, subsequently in the 1990s. By 2025, we now have 30 universities, 30 public universities in the province of Sindh established by the Pakistan People's Party government. And in addition to these 30 universities, we now have 18 instead of those 2 campuses. That further extends the reach of these universities into our rural and more far-flung areas of the province.